Hello friends, good evening. This is Dr. Manjunath, your FMT guru. Today we are going to discuss identification and forensic psychiatry. The most important long essay, short essay and short answer. I'm audible and visible. Yes guys, I'm audible and visible. Yes, good evening Rakesh. Yes, good evening all, good evening. Chalo, let's start. Rakesh, fine. लाश एक मुंह गवाह है जो कभी झूठ नहीं बोलती. What do you think? Dead body is a silent witness that never lies. Is it true or false? Here is a case of an unknown poisoning. During post-mortem examination, the color is cherry red. My question, what is the probable cause of death in this case? The post-mortem hypostasis, no injuries on the body, but over the gravity area, there is a presence of cherry red post-mortem hypostasis along with contact pallor. So what would be the best answer for that? Good evening all. Yes, Ayush beta, very good. Ranjan, Ayush Vain, Rakesh, Srinivas, yes, carbon monoxide poison. So try to memorize carbon monoxide poison, cherry red. Normal color is purplish red or purplish blue. With this introduction, let's start identification. Before that, I have a question for you. Here is a case of identical twins. One is good, one is bad. The good is money, the bad is Atreya. My question is, what is the best way to identify the accused or the culprit in case of identical twins? So good boy and a bad boy. The good boy is money, the bad boy is Atreya. It is from the movie 24, Identical Twins. Can anyone try? What is the best answer of the best technique to identify in this particular case? In identical twins, DNA is same, VNTR is same, DNA fingerprinting is same. The answer is fingerprint. The fingerprint is the best method of identification in case of identical twins. It is not the DNA fingerprint. DNA fingerprint? No. So the first answer by Mr. Ranjan SN. Ranjan, excellent answer. The answer is fingerprint. Very good. Good. Ayush Vain, yeah, heard about the college. It's okay. Hanik, yeah, fine. The first topic is fingerprint. Very important 5 marks question, commonly asked 3 marks question. What is fingerprint? Types of fingerprint? What are the alterations in fingerprint? Medico-legal importance. Medico-legal importance in civil cases, criminal cases. So fingerprint is part of many documents now. So like the property registration, Aadhaar card, driving license, now everyone, your phone. So the fingerprint based. So the technique is known as dactylography. 5 marks question, commonly asked. So let's start fingerprint. What is fingerprint? The fingerprint is known as Galton system, also known as dermatoglyphics. They are formed during 24 weeks of gestation. 24 weeks, that means around 6 to 7 months. So they are formed within the womb. Fingerprint, EFP. So all of you write in the chat box. 6 to 7 months, fingerprints are completely formed. The fingerprints are basically the print that is caused by the epidermal ridges. You know, epidermis, dermis. They are basically formed by epidermal ridges and are also opening of the sweat glands. The sweat along with the epidermal ridges, they give a classical print that is known as dactylography. One very important technique in criminal cases and civil cases. The fingerprint is equal to 6 to 7 months. Write this in chat box. The proof of identity as per the Lockhart. So nowadays it is very easy. It's all computer based. So long back, maybe 20-30 years back, the proof of identity is basically in comparison of 12 points as per the Lockhart. It was first used by William Herschel in 1858, long back, around 150 years back. Francis Galton systematized this method in 1892, further improved by Edward Henry. That's why it is also known as Henry Galton system. Dactylography, dermatoglypics, fingerprint, Galton system, Edward Henry system, everything that is same, that is fingerprint. Okay, chalo. Then first bureau, the first bureau was started in writer's bleeding at Kolkata. Okay. Now here is the question. Here is the father of DNA fingerprint. Here is the father of fingerprint. Can anyone identify these personalities? Anyone? DNA fingerprint, the principle is VNTR. Variable number tandem repeats. The fingerprint, the principle is epidermal ridges. Epidermal ridges. Okay. Alec Jeffrey. William Herschel. Okay. Chalo. Next. Types of fingerprint. 3 marks question. So there are 4 types are there. Loop, arch, oval and composite. Look at this image ABC. Can identify the fingerprint? The A, you can see in A, the starting point and the ending point on the same side. So it has one core and one delta. A is equal to one core, one delta. So core means curving ridge. Delta means 3-directional meeting point. If one core, one delta is there, the answer is very simple. That is loop. If central circle is there, 360 degrees circle is there, 2 delta, then it is oval. 2 delta, that is oval. No core, no delta, that is basically arch. So arch is equal to no core, no delta. So this is very, very commonly asked question. You can see here the image here. Entry point, exit point on the different side, that is arch. Central circle is there, 2 delta are there, then oval. One core, one delta, that is basically loop. When it is mixed, that is known as composite. Most common fingerprint is loop. The least common fingerprint is composite. Okay, this is very commonly asked question. So there are 4 types. So Srinivas is asking, sir, what is core and what is delta? Very good question. So beta core देखो इधर. Core मतलब curving ridge. Delta means like this delta. 3-directional meeting point. 3-directional meeting point. Is it clear, Srinivasan? Ranjan, Rakesh, समझ में आ रहा है ना आपको? Okay. Now come back to the picture again. So 4 types we discussed. Next question comes is, if partial fingerprints are there in the crime scene, murder case, rape case, partial fingerprints, then you can use poroscopy. The poroscopy is the study of pores, the size of pore, distance between the pore, number of pores per millimeter area. It was first explained by Locard. So in exam, you can mention about poroscopy. It was first given by Locard. 1 millimeter area, around 9 to 18 pores are there. The arrangement of pores is known as poroscopy. This is a good question, very commonly asked. Now, can anyone identify the fingerprint here? This picture? This is a very interesting picture. Here is a case of fingerprint during examination. During examination of the accused, you can see here, what is this actually? What is this condition? The condition without fingerprint. In some cases, rare cases, in certain syndrome, fingerprints can be absent. Okay, there are many syndromes. Try to memorize this. Okay. Okay. So what are the conditions in which there is a mutilation of fingerprint? No fingerprint at all. So no fingerprint or loss of fingerprint permanently seen in 3 conditions. One is radiation injury. One is radiation injury. When fingers are exposed to radiation, ionizing radiation, or fingers are exposed to electrocution, or leprosy, or some drugs like capecitabine. So 4 conditions. Memorize like this: radiation, electrocution, leprosy, and capecitabine. In all these conditions, there can be permanent loss of fingerprint. Okay. Yes. Bahut badhiya. Now you need to write this. What are the conditions mutilation of fingerprint? The pattern is retained but change in the distance between the ridges. The condition is acromegaly rickets. Acromegaly, excessive secretion of growth hormone. That leads to normal pattern but distance increases. Acromegaly. Rickets, basically deficiency of parathormone or vitamin D deficiency. Or moderate epidermal ridge atrophy in celiac disease, celiac sprue, hypersensitivity to certain food substances, like example gluten, incomplete dermatitis, permanent loss, radiation, leprosy, electric injury, and capecitabine, ridge alteration, scleroderma, especially limited scleroderma. Then fingerprints are absent in certain conditions, like example Beard syndrome, Ginser-Cooley-Ingemann syndrome, Nagelli syndrome, dermopathia pigmentosa reticularis, adermoglypia. All these conditions, fingerprints can be absent. Remember, it's a very rare condition. Very rare. These syndromes are genetic conditions. They are usually rare. Ho gaya. Ayush Jain. Where are you, Ayush Jain? Sir, if there are 3 types of fingerprint, how to identify? No, it is not identified with the help of the type of fingerprint. It's basically the type of the ridges, the distance between the ridges. Okay, it is not about the pattern. Sometime there can be 5 loop, 2 or 3 hole, 1 or 2 composite also. This is not the way to identify. So that needs some expert science to identify with the magnifying lenses. Nowadays it's computer based application, so we can compare with the accused the fingerprint as well as the fingerprint that is found in the crime scene. That's a computer based application. We do take multiple points, not only single point, multiple points. Okay, so this is what important in exam. Ayush, Jean, Srinivas, have you understood this? ठीक है, बहुत बढ़िया, ठीक है. Next important. Okay, chalo, I'll repeat again, guys. Fingerprint is a very important question. You need to write all these points: definition, complete formation, proof of identity, invented by, first bureau, then types of fingerprint. Then you can write about the mutilation of fingerprint and some indications. So what are the indications? Civil indication and criminal indications. That is more than sufficient. Yes, good. Game mind world. Okay. Now look at this. This is one more very interesting question related to theory of identification. Here is a case of murder. In murder, there are some cigarette butts are there. Cigarette butts. Over the cigarette butt, lip prints are there. Is it possible to identify the person with the help of lip print? Is it possible? Yes or no? What is that known as? If so, what is this technique known as? Is it dactylography, palletography, kiloscopy, Bertillon system? What is the best answer? Identification of a person with the help of lip print. There are 5-6 types are there. Yes, come on guys. Anyone? Lip print. Bahut badhiya. So Rakesh is telling, sir, it is lip print. So lip print can be 3 marks question. So there are 1, 2, 3, 6 types are there. Type 1, clear cut vertical grooves that run across the entire lip. That is type A. Or we can say type 1. Type 1 prime, vertical but do not cover the entire lip. If it is branched, like this, branched, that is type 2. Intersected, type 3. Reticular, type 4. Undetermined, that is type 5. So one has 1 and 1 prime. If it is complete, then it is type 1. Type 1 prime means incomplete, but across the lip. If it is branched, then it is type 2. If it is intersected, then it is type 3. Reticular grooves are there, then it is type 4. Undetermined, matlab mixed, matlab type 5 hai. There are 5 types are there. This classification known as Suzuki classification. Suzuki classification. This is not admissible in court of law. Remember, lip print or kiloscopy, they are not admissible in criminal court or civil court in India. Though it's a very good, interesting technique, it is not the 100% proof of the identity of the person. Yes, all of you write in the chat box, kiloscopy is equal to Suzuki. Suzuki, my favorite. Suzuki. Kiloscopy is equal to Suzuki. Kijusu. Okay. Keep writing guys, keep writing. Now look at this now. Now here is the type of fingerprint in the crime scene. You can see here, it shows like this. Identify this type of fingerprint, type of kiloscopy. So this is basically type 1 prime. It is incomplete, that's why. Okay. Next comes is one more 5 marks question commonly asked in the exam, Gustafson method. See, Gustafson method is a method of age estimation after the age of 21. Up to the age of 21, you can use ossification center, you can use dentition. After 21 years, after 25 years, especially in dead body, Gustafson method used in dead body, you can estimate age by looking at the tooth or looking at the teeth by using some microscopic, macroscopic criteria. That method is known as Gustafson method. Other methods like Stack's method, Boyd's method, other methods are there, but Gustafson is commonly asked 5 marks question. Now look at this. This is a dead body. In crime scene, we have skeletal remains. Maybe mandible, maybe skull is there. The police officer usually they ask, "Sir, age क्या हो सकता है? 30 years, 40 years, 25 years." So age can be estimated by using a method, Gustafson method. You need to take out the teeth. You need to examine, especially the front teeth, not the posterior teeth like molars. Canine is very useful, incisor teeth, or canine, or you can see premolar also, but not the molars. We have 6 criteria. The 6 criteria you can remember with the help of mnemonic APSRTC. Very interesting mnemonic, Gustafson method, APSRTC. Write this in chat box. APSRTC. Very interesting. A for attrition. Attrition, what do you mean by attrition? The attrition means loss. Loss of upper surface. That is known as attrition. Parodontosis, that means loosening of the teeth. Secondary dentin, that is the calcium deposition. Root resorption, that is basically loss of dentin tissue or loss of dentin tissue at the root resorption. Cementum apposition basically incremental lines. Transparency of root or translucency of root which increases. There are 6 criteria are there. The best criteria, transparency of root. Second best criteria, secondary dentin. So this is very, very important theory question, Gustafson method. Mnemonic is APSRTC. So try to memorize this. Yes. Okay, both बढ़िया. Now I said already, you can estimate the age. The formula is age is equal to 11.43 plus 3.63 multiplied by the score. So in years. So again plus or minus 5 years actually. So Gustafson method very simple. I'll repeat again, Gustafson method after the age of 21 by using front teeth. Microscopic examination used in dead person. There are 6 criteria are there. Mnemonic is APSRTC. A for attrition. Attrition means basically loss of the upper surface of the teeth. Parodontosis means loosening of the teeth. Secondary dentin, accumulation of calcium within the root cavity. Root resorption due to osteoclast, there can be loss of the root. Then the transference of root that increases as it advances. Cementum apposition, that is basically incremental lines. Okay. So this completes your Gustafson method, very commonly asked 5 marks question. चलो हो गया. आगे देखते हैं next question. Next question 3 marks question from identification, cephalic index. Cephalic index. So can anyone tell me what is cephalic index? What is the use of that? Now look at this. So here is the skull. The cephalic index is maximum breadth of the skull. So this is the maximum breadth between the palatal eminences. So maximum breadth divided by maximum length multiplied by 100. This is basically used for estimation of race. Yes, good. That is basically depends on the value. Dolichocephaly, that is 70-75. That is usually in pure Aryans, Aborigines, Negros, blacks. Mesenterocephaly 75 to 80, Europeans, Chinese and Indians. Brachycephaly 80-85, Mongolians. This is very important concept. So try to memorize this. So dolichocephaly, mesenterocephaly, brachycephaly. Maximum cephalic index seen in maximum cephalic index, brachycephaly. Minimum cephalic index, dolichocephaly. But the same question asked, anterior posterior diameter is maximum in dolichocephaly. Anterior posterior diameter is maximum in, that is dolichocephaly. Anterior posterior diameter is minimum in brachycephaly. It was first explained by Swedish anatomist and Rhesus in 1842, long back. It's basically estimation of the race. Simple question, 3 marks question. It's a part of practical exam as well. The question can be asked, beta what is cephalic index? आपको बोलना है सर cephalic index मतलब maximum breadth of skull है, maximum length of skull multiplied by 100. इसमें three types हैं, dolichocephaly है, mesenterocephaly है, brachycephaly है. तो maximum होता है brachycephaly में, minimum in the dolichocephaly. Indians mesenterocephaly. Okay. Yes, good Rakesh, excellent answer. That's great. Now one more 3 marks question, important question from the identification is Barr body and Davidson body. See, Barr body, Davidson body, they are inactive X chromosome. So like example in females, there are 2 X chromosomes are there. So one X chromosome is inactivated, that is visible as Barr body. Barr body in the buccal smear, Davidson body in the neutrophils. So just write in the Barr body. Barr is seen in, वहाँ कहाँ पे होता है, buccal smear. लिखो buccal smear. डेविडसन बॉडी कहाँ पे होता है बताओ, न्यूट्रोफिल में, न्यूट्रोफिल. Davidson body is basically a drumstick body which is attached to the lobe of the neutrophil. The number of Barr body is equal to x minus 1. X minus 1. Number of Barr body is equal to x minus 1. Like in female, it is 2 minus 1, that is 1. In male, it is 1 minus 1, that is equal to 0. Can anyone tell me number of Barr body in Klinefelter syndrome? 47XXY. Number of Barr bodies. XXY, Klinefelter syndrome. Male having feminine features. Or in Turner syndrome. Anyone? Number of Barr body. Or super female. 47XXX. Or super male. XYY. Again, it depends on the number of X chromosome. Okay. Good. चलो हो गया. So this is very important 3 marks question. बहुत बढ़िया. So all these are important questions. Identification basically a chapter of practical examination. Now comes is your one more question from psychiatry. Psychiatry, one very commonly asked question is criminal responsibility of insane person, criminal responsibility of bipolar disease, schizophrenia, psychotic depression, insanity, psychosis. The answer is same, McNaughton's rule. There are many rules are there. We have Durham's rule, Curran's rule, irresistible impulse test, American Law Institute test and all. One commonly asked is McNaughton's rule. Now, what is McNaughton's rule? 3 marks question. In exam, you need to mention the same definition. Every word is important here. That is 22 BNS. So all of you write in the chat box, 22 BNS is equal to schizophrenia. Just write schizophrenia. Just right. Schizophrenia is example for insanity. Very common insanity. That's why I said schizophrenia. Previously it was 84 IPC. So BNS means Bharatiya Nyaya Samhita, IPC means Indian Penal Code. So it states that nothing is an offense. Nothing matlab it can be murder, it can be hurt, whatever, anything. It can be murder also. It can be any crime. Is an offense which is done by a person, male or female, who at the time of doing it, the word is important, at the time, by reason of unsoundness matlab insanity matlab क्या है? Psychosis है. Psychosis matlab bipolar disease. Insight is absent. Schizophrenia, split personality, psychotic depression, all incapable of knowing the nature of the act, incapable. So testamentary capacity is absent. So mental capacity to understand the crime is absent. That he is doing what? Either wrong or contrary to the law. This is the standard definition. You must write in your answer sheet to get distinction mark. Just revise once, twice. So it's easy. Good. 22. Rakesh beta excellent. Anu, Ranjan, Srinivas, Bhumika, very good. All answering. That's great. Now my question here is whether revenge is included in 22 BNS or not. Revenge or avenge. For example, an insane person is committing an offense, or any person who is committing an offense by keeping revenge in his mind. Revenge. Is it offense or not offense? Revenge is there. The intention is revenge. Revenge lena hai, avenge karna hai. So whenever word revenge is there, then it is not applicable. The McNaughton Rule is not applicable. That means insight is present. Insight honge, McNaughton's Rule is not applicable. It is applicable only to those persons who are incapable of understanding the nature of the act, what is either wrong or contrary to the law. The answer is no. Ranjan is telling no. Bahut badhiya. Now look at this. So this is very interesting question. In 1843, the Mr. Edward Drummond, the private secretary of the Prime Minister of England, Sir Robert Peel, was shot dead by young Scotsman Daniel McNaughton. So Daniel McNaughton was suffering from delusion. He was suffering from delusional disorder, schizophrenia. McNaughton was suffering from delusion of persecution. In fact, it is the most common delusion in psychiatry. He believed that his life was in danger. Life है ना danger में है. क्यों danger में है? Acts of persecution by the Tory party on him. He shot dead Mr. Drummond on the belief that he was going to kill the Tory party Prime Minister, Mr. Peel. He tried to kill him, and during that he killed his personal secretary. So my question is, is it punishable? Not punishable. Is it punishable? Not punishable. Yes or no? So delusion of persecution is there, and here crime is murder. The murder in 1843. My question, is it punishable, not punishable? All of you right. It is an offense. Ranjan, Anu. Yes, so it is not punishable. This is the real incident happened in UK or London. The McNaughton is the name of the mentally ill person. Asked in your FMG exam also, NEET PG. Other rules are Durham's rule. एक होता है Durham's, Curran's, American Law Institute test, ALI. Okay. Irresistible impulse test. So there are tests like this. Dharam, Currents, ALI, and irresistible impulse test. Along with McNaughton, there are 5 rules are there. In India, we follow 22 BNS. That is nothing but the McNaughton's rule. I hope you understood. For your level, UG level, this is more than sufficient. Okay. Good. That's okay. बहुत बढ़िया. आगे देखते हैं. Now see in exam, the question asked is delusion. What is delusion? What are types of delusion and all? So there are different types of delusion. Delusion of persecution, delusion of grandeur, delusion, nihilistic delusion, Capgras syndrome, Frigoli syndrome, delusion of reference, Fourier-Duoc syndrome. Delusion is a 5-mark question. Now I'll discuss briefly about 1 or 2 delusions in the class. Rest all you can go through the textbook. Now look at this. Here is the delusion. A mentally ill person suffering from mania. He's suffering from mania. He thinks that he's very powerful. He is more powerful than Mr. Donald Trump. He thinks that he can blast 2 bombers in a second. 2 bombers. And sometime, one more example, a student thinks that he is very intelligent. He is very powerful. His IQ is more than 140. And he thinks that he will get first rank in AIMS without reading anything. What type of delusion is this? So in a funny way, guys, so what type of delusion which is common in mania? ठीक है, बहुत बढ़िया. Yes, come on guys, you need to understand. You need to answer. Very interesting question. Mentally ill person thinks that he is powerful than Donald Trump. Powerful than anyone. What type of delusion is this? This is classical delusion of grandeur. कहाँ पे होता है? Mania में होता है. Elated mood, mania. Mania along with the depression known as bipolar disease. It is an example for psychosis because insight is absent. Awareness about the one's soul illness is absent. So this is mania. Delusion of grandeur. One very commonly asked 3-mark question. Okay, good. Anu answered correctly. Hanik also answered correctly. That's great. हाँ, एक और है. Very interesting question है. Very interesting. You can just try. You can remember in a funny way. See, during my college days, one very famous actress, Om Shanti Om actress, Deepika Padukone. Okay. Now, here a person suffering from delusional disorder thinks that Deepika Padukone is in deep love with him, though he never met her. He thinks that Deepika Padukone, who got married to Ranveer Singh, Dhurandhar, he thinks that Deepika Padukone is in deep love with her. Second thing, what type of delusion is this? Deepika Padukone बहुत प्यार करती है, हालांकि उनसे कभी नहीं मिला. ये किस प्रकार की भ्रम है? See, the love is okay, fine. But here, try to interpret this. He or she thinks that the person from the higher standard is in love with her or him. Usually celebrity, usually a cricketer, sometime teacher. Yes. What type of delusion is this? You need to understand. So this is known as erotomania. ये क्या है बताओ? Erotomania. Also known as de syndrome. It is common in females. It can be 3-mark question. 3-mark question. Very good. The first answer by Mr. Anu. Anu D7B21. delusion of love, erotomania. Hanik is also answering. Excellent answer. Great. Next question is, here is a person. The person suffering from love failure, depression, psychotic depression. The person thinks that he is already dead. He is already dead. The world is going to end. You are going to die. My kidney, liver not working. Why are you preparing for exam? What type of delusion is this? ये किस प्रकार की भ्रम है? ये नॉर्मल है, abnormal है? Abnormal है तो कौन सा delusion है? So this is very common in depression, I said. Psychotic depression. So this is known as Cotard syndrome. एक और नाम है इसका, nihilistic delusion. Nihilistic delusion. Sometimes there can be suicide also. Suicidal tendencies. Cotard syndrome. Anu, Hanik. Srishant is answering. Well and good. Srishant Bellamakunda. Excellent. बहुत बढ़िया. Okay. Now this is also a very interesting question. Unfamiliar people are mistaken for someone you know. Unfamiliar people है mistaken for someone you know. A beggar is mistaken for your boss. A mentally ill person thinks that a beggar is mistaken for boss. Like example here, beggar is there. Here is the Donald Trump. So Donald Trump is boss. The patient thinks that beggar is the Donald Trump. No, he's not beggar. He's basically Donald Trump. So what type of delusion is this? It's a delusion of misidentification. So either it can be Frigoli syndrome or Capgras syndrome. Delusion of doubles. Okay, very good. ठीक है, हो गया. Now comes his impulse disorder. Some question can be asked about the impulse disorder. Impulse can be 3 marks question. Impulse means sudden irresistible urge to do something. Insight is present. It is not included in McNaughton's rule because cognition is present. There are different types of impulse disorder. Like example, kleptomania. Kleptomania. Pyromania. Trichotillomania. Trichotillomania. Okay. Oniomania. Run amok. Pathological gambling. Or intermittent explosive disorder, IED. Intermittent explosive disorder. There are many types are there. So kleptomania is basically stealing things. Pyromania, setting fire. Trichotillomania, pulling hair. Oniomania, that is impulse of shopping. Run amok is impulse of killing. Pathological gambling is a betting, pathological betting, irresistible urge. Now look at this. Here is the lady. So imagine Victoria. Queen Victoria was having this. Tension before theft. Lot of tension before theft. I feel so uneasy. I must take something. So a girl from very high standard, very rich. So she thinks, I feel so uneasy. I'm not feeling well. I must take something. Then theft. Theft matlab, okay, no one is seeing, I will take it. Matlab inside isme hai. I feel so good, such a relief, pleasure, relief during the theft. And after some time, there will be guilt of the theft. I should not have done this. I feel guilty. So what is this classical presentation? Tension before theft, then theft, pleasure, relief during the theft, guilty after theft. मतलब inside totally present है. ये क्या है? Anyone? What is this known as? प्रीतम पॉल, अनु, रंजन, श्रीशांत, बेल्लमा खोंडा, हनीक. बहुत बढ़िया. Can anyone try? So this is classical kleptomania. Kleptomania. This is okay. Now can anyone identify this? Look at this. This is very interesting image. Urge to gamble. I feel urge to play, especially IPL. I need that excitement. Then gambling. This is exciting. He participates in gambling despite knowing the risk. Oh, what a thrill! What a thrill! Feels pleasure, very happy. बहुत संतुष्ट है, excitement है, relief है while playing. Okay, बहुत बढ़िया. I am playing. Then after that, he lost control and he will continue. I lost again, but I will win back. Unable to stop. Continues despite of losses and a problem. So one day he will become bankrupt. He'll become totally penniless. Lot of loan, personal loan, every loan. Sometime it leads to depression. Sometime it can lead to suicide also. What is this known as? So this is known as pathological gambling. So Hanik, Ranjan, क्या है? Pathological gambling. Okay, हो गया. Question can be asked. Now this is a very interesting question. All of you look at this. This is something interesting I felt. Look at this. This is also impulse disorder. Here, usually common in males, can be seen in females also. There is some tension. So build up of some tension. That person becomes irritable. He becomes very irritable, angry, गुस्सा, feels tension building up. टेंशन हो रहा है. उसके बाद explosive outburst, sudden loss of control, may shout, may hit, throw things. Short duration only, few minutes only, maybe 10 minutes, 5 minutes, maybe 1 hour. After that, some relief, some calmness. Okay. Feel relief, calm after the episode. But after some time, he feels very, very guilty. Guilty of regret, guilty of shame. यार ये गलत है यार. So what is this impulse disorder known as? So build up of tension, explosive outburst, short duration, relief or calmness after the incident, regret and guilt. इसको हम क्या बोलते हैं? ऑप्शन है इंटरमिटेंट एक्सप्लोसिव डिसऑर्डर, एंटी सोशल पर्सनालिटी डिसऑर्डर, बाइपोलर 1 है, सब्सटेंस यूज डिसऑर्डर है. बहुत बढ़िया. एनीवन? Can you try this? This is known as intermittent explosive disorder, known as IED. Okay, explosive disorder. Okay. Then after the class, after this session, just go through types of hallucination. So hallucination means perception without stimulus. There are different types are there, visual hallucination, auditory hallucination, tactile hallucination, and other types. Just go through that. It can be a 3 marks question. Pakka question in exam. Then civil criminal responsibility of insane person. So already we discussed criminal McNaughton's rule. Civil responsibility is like a marriage, divorce, property, testamentary capacity and all. You can go through. Again, it is a 3 marks question. DNA fingerprint, especially from identification, 3 marks question. Identification data, 3 marks question. Tattoo can be 3 marks. Scar can be 3 marks. Superimposition, very commonly asked 3 marks question, comparison between skull and the photograph. Then cephalic index, 5 marks question. True insanity, feigned insanity, 3 marks question, or sometimes 5 marks question. Psychosis, neurosis, 3 marks question. And then lastly, corpus delicti. Corpus delicti means body of offense or essence of crime. So like example in murder, dead body, the weapon, bloodstain can be corpus delicti. Corpus delicti is an important part of the investigation. For example, murder, where is the dead body? What is the weapon used? So what is the fingerprint that is found in the crime scene? What is the cause of death? All that is included in the corpus delicti. So all these are 10 questions. You can just go through this after the class. Very, very important questions. Are you okay, guys? Yes. Anu, Ranjan, Shishant, Hanik, Rakesh, Ranjan, all, come on. Any doubt in this? Any doubt? Now I have 10 questions today, 10 last questions about the spotters, like a part of the Booth Bungalow series, part of the forensic mystery, part of the forensic spotters. So we are going to discuss 10 important topics. It can be 3 marks question, it can be image based question, it can be Viva question, practical question, sometimes short essay also in next 10 to 15 minutes. Any doubt राजेश, राकेश, रंजन, हनिक? Okay, no doubt. बहुत बढ़िया. आगे देखते हैं now forensic spotters. Okay, now this is very interesting question. Already I said, already I discussed. Just try to answer. A mentally ill person, schizophrenia person, mentally ill person. They are. He thinks that they are reading his mind. They are reading my mind. My neighbor is helping CIA spy on me so they can kidnap me and kill me. My co-worker is copying all my work and communication to try to get me fired. The helicopters above are from the government. They are following me. So what type of delusion is this? And what is the rule of insanity? You need to type in the chat box. That's all. Okay. So I'm going to give you 10 seconds time. So try to answer what is this classical delusion known as, which is commonly seen in schizophrenia. In schizophrenia, there are various symptoms, like example, delusion, hallucination, disorganized speech, disorganized behavior, negative symptoms or negative symptoms, like example, blunt affect and all. My question is very simple. What type of delusion is this? Delusion is disorder of thought. Come on. So this is excellent, good. The first to answer by Hanik. Hanik beta, बहुत बढ़िया आंसर. A delusion of persecution. हो गया? Very good. The next question. The next question is a very important question from identification, the medico-legal importance of age. So the question is a very interesting scenario. Look at this. Male and female. Okay. Boyfriend and girlfriend. Boyfriend and girlfriend, close relationship. The girl age is 17 years. Said it is 17 or 16 years. The male age is 21 or 22. So boyfriend and girlfriend story. So very common nowadays, as you know. There is a history, or they were found in a room. They were found in a house. Okay. History of sexual intercourse. The case was filed by the father of the girl. The case was filed, that is basically 64 BNS. The rape case was filed by the father. The age of the girl, I said, 17 years. The age of the boy is 21 years. My question, is it rape or not a rape? Sexual intercourse was done with the consent. Is it rape or not a rape? Can anyone answer? Come on, try. Ranjan, Rakesh, and others. I said in my class, when age of the girl is less than, age of the girl or boy less than 18, we call it a juvenile. If age of the girl less than 18 years, even with the consent, it can be considered as rape, or we call it as statutory rape. So it is a statutory rape. Rajesh Srinivasan, excellent answer. Now the question here is age. So there is no other card, there is no birth certificate. So now the victim was sent into forensic department. In the forensic department, the X-ray given is wrist X-ray. Look at this. The wrist X-ray is given. What is the age? Can anyone estimate the age? So this is radius. This is ulna. This is physiform. This is capitate. And this is scaphoid. And this is first metacarpal. First metacarpal. So what is the age with this X-ray? Lower end of radius is not fused, so less than 18. Hanik is telling, sir, 15 to 17. Bahut badhiya. So answer is sure. The age of this X-ray is less than 18. Why? Because radius and ulna appeared. The lower end is appeared but not fused. So it is less than 18 year. So it can be less than 17 year also. Okay. Now my question is finally, is it a love story or crime story? The same story. After reading this X-ray, what do you think? A love story hai or crime story hai? Anyone? Just type crime story or love story. So having intercourse with the female of age less than 18 years, even with her consent, with or without consent, is considered as rape as per the rule 64 and 63 BNS, and also under the sections of POCSO, protection of children from sexual offences, juvenile. Okay. Crime story. Rakesh is telling, sir, crime story. Srinivas is telling love story. Beta love story nahi hai, crime story. Age kya hai dekho? Less than 18 years hai na. So automatic arrest. Why? Age less than 18 years. POCSO, non-bailable offence. Love story. Ranjan is telling love story. Yeah, it can be love story, but turned into crime story later. Okay. Chalo, bahut badhiya. Now look at this and tell me, is it a crime story or love story? Same scenario. I'm not going to explain. Is it love story or crime story? ये देखो radius is appeared and fused. ये देखो radius है ना, appeared and fused. Radius is fused. Ulna fused. Physiform appeared. First metacarpal fused. Fused. ये क्या है बताओ? So Rajesh is telling, sir, it is okay. Love story. चलो बहुत बढ़िया. Ranjan, okay. Hanik, Rakesh, ठीक है. Excellent answer. The first answer by Rajesh, very good. Srinivasan, that's great. Okay. So this is about the fourth question. Now the fifth question. The fifth question, look at this question. Here is a case of poisoning. A patient came with a history of 90 manifestations. Delirium, dryness, dilatation, and 90 manifestation. Basically delirium is there. The patient is totally deliriant. Deliriant, matlab disturbed consciousness. Dry as a bone, beat as a, red as a beet. Okay, confused, delirium. So spiny projections are there. Drug of choice is physostigmine, kidney shaped seeds, double edged, they are confused with chili seeds, road poison. ये क्या हो सकता है? The answer is thorn apple. So very good. First answer by Rakesh, Datura and Hanik also. Anu also, very good. Anu, excellent answer. Anu, बहुत बढ़िया, excellent. ठीक है. The treatment है ना physostigmine. याद रखना दथुरा 90 मैनिफेस्टेशन, ड्रग ऑफ चॉइस इज physostigmine. थॉर्न एप्पल हो गया. Now look at this question from forensic psychiatry. There are three personalities are there. A patient suffering from some personality problems, three personalities are there. Ramo, all the three personalities. What is this known as? Real case of personality disorder, three personalities, and the person is unaware of this fact, unaware of his insight. Insight is absent. Insight is totally absent. What is this known as? Can anyone tell me? Good. So this is classical case of dissociative identity disorder. The meaning of that is presence of two or more distinct identities. Our personality states that recurrent take control of behavior. So the question can be asked, what is multiple personality disorder? That is dissociative identity disorder. Okay. Depersonalization disorder, persistent feelings of detachment from the oneself, or it can be fugue, abrupt change in the geographic location with the inability to recall the past and loss of identity. So there are three types of dissociated disorders or dissociative disorder. एक है identity, एक है depersonalization, एक है dissociative fugue. So this can be asked in your exam. Ranjan, this is not split personality. This is multiple personality. The split personality means schizophrenia. Try to understand common mistake. Split मतलब schizophrenia. लिखो ये. Split is equal to schizophrenia. It is not dissociative identity disorder. So split in the thought process, that is schizophrenia. There are 5 classical features. Basically, delusion, hallucination, disorganized behavior, disorganized speech, and negative symptoms. Okay. So definition of schizophrenia can be asked in psychiatry. In forensic, if you know this basic symptom, that is okay. 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 Anu, Rajesh, everyone, please write split is equal to schizophrenia. Okay. Chalo. Now this is interesting question. A 21-year-old woman is reported missing by her parents in New York. Years later, it is discovered that she is living in Florida. She has no recollection and of her previous life in New York. So Florida and New York. Look at this. What is the answer? Is it dissociative identity, depersonalization, or dissociative fugue disorder? 3 options hai. Option 4 hai schizophrenia. So what is the best answer? I am just waiting for your answer. Yes. Anu, others please answer. Try to answer. ये डिमेंशिया नहीं है, ये है फ्यूग, डिसोसिएटिव फ्यूग डिसऑर्डर. क्या है? फ्यूग. Good. Ani, good answer. Then question number 8. Question number 8 is, look at the image, look at the question. Again, forensic spotter I said, so in all the classes we are going to discuss 1 or 2 snakes. It commonly asked, snake bite is commonly asked main question. Now in this question we have 2 snakes. One has a hood and spectacle mark. Other, it has a brown spots over the body. And one is neurotoxic, one is hemotoxic. So one has a long needle-like fang, one has round short fangs. So my question is, identify these 2 snakes, A and B. What are they? ठीक है. good answer. So one is common cobra, and one is your Russell's viper. कॉमन कोबरा न्यूरोटॉक्सिक है, याद रखना पड़ेगा. रसल वाइपर है ना, हीमोटॉक्सिक है. तो हीमोटॉक्सिक DIC, increase clotting time, increase bleeding time, leading to death. Neurotoxic cause respiratory paralysis. Respiratory paralysis. याद रखना पड़ेगा. And remember, treatment is ASV, anti-snake venom. Okay, good. Many answered. First answer by Hanik again. Hanik also, and first answer I think Ranjan beta. Ranjan, excellent. Ranjan SN. The good answer. It is basically Ranjan SN. Good. बहुत बढ़िया. ठीक है. Shubham Kumar is telling Sir Russell. Then comes his interesting question from yesterday's class. A doctor involved in sexual affair with the patient can be charged with the which of the following as per NMC regulation? Doctor involved in sexual affair with a patient can be charged with the which of the following as per NMC regulation? Infamous conduct covering dichotomy, association. Dichotomy means fee splitting. Association known as covering. Covering means that is basically allowing the non-medical person or unqualified person while during medical examination or during surgery or during delivery. So what is this known as? Answer hai adultery. So answer is, it is basically infamous conduct. It comes under adultery. Even covering, dichotomy, association also infamous conduct. The best answer here is it is adultery or infamous conduct. Good. It can be 68 BNS. Very good. Then one more snake question. The most common manner of snake bite is, the snake bite can be suicidal, it can be homicidal, it can be accidental. Very simple question. The most common manner in general, it is accidental. Sometimes it can be homicidal also, like Uttara murder case, or Cleopatra case is classical case of suicidal snake bite. Rarely suicidal, commonly accidental. So what is the best answer? Accidental. Shubham Kumar, very good. Anu, good answer. Accidental. बहुत बढ़िया. So this completes 10 question. Yeah, this was the 7th question, 8th question, 9th question, and the 10th question. So what is our final score, guys? Out of 10? What is our score? Just answer my question. So we completed some important questions in today's class. Basically, dactylography, that is a very important topic. Then cheloscopy. Cheloscopy is also important question. Then delusion and types, impulse disorder, 1 or 2 examples. Phobia can be a 5 marks question sometime. McNaughten rule, very commonly asked 5 marks question. Definition, commonly asked. So this completes your today's lecture. If you have any doubt, you can ask me. Try to memorize all these important topics very commonly asked, especially Gustafsson method, and also you mentioned the feedback about the today's class. Feedback. So we'll come up with some more important long essay, short essay, and short answers. In tomorrow, day after tomorrow class, we have 3 more classes, and also 2 practical classes are scheduled. FMT practicals covering all 8 exercises. So like how to write injury certificate, age certificate, drunkenness certificate, victim examination, accused examination, spotters. So we discussed many times in our classes. So 2 classes more than sufficient to complete forensic practicals. Yes guys, I hope you understood today's topic. Basically identification and your forensic psychiatry. Srinivas is telling, sir, 7. बहुत बढ़िया Srinivas. Srinivas, 7 means distinction. Anu, excellent answer, 9. Shubham Kumar, Subhash Kumar is telling, sir, your tricks are amazing. Thank you, beta. Thank you so much. And Ranjan SN is telling, sir, interesting. Good. Srinivas, बहुत बढ़िया. Chalo, now I think I have one more important question. Anyway, so I have 2 skulls here now. Last 2 minutes, we are going to discuss some more topics. Wait for 5 minutes, guys. Don't leave. Give me 5 minutes. Yeah. Fine. Yes. Now, in the crime scene, we have 2 skull. Okay. 2 skull. My question is left hand, right hand. Okay. Left hand, right hand. The left is very light, right is very heavy. Look at the forehead. Left it is straight, right it is steeper forehead. So my question is, so male or female? So look at this now, this skull. Straight forehead. It's light. Oval shaped orbit. The frontonasal junction is not prominent. You can see here. Frontonasal junction. You can see the sharp orbital margin. Okay. Supraorbital eminence is not prominent. But the frontal eminence and the parietal eminence, look at the parietal eminence. The parietal eminence is very large. Frontal eminence is also large. Straight forehead. Look at the foramen magnum. Foramen magnum is small. Look at the foramen magnum here, it is big. So my question, so left and right. So identify male or female. So Ranjan is telling, sir, left is basically female. हाँ, very good. बहुत बढ़िया, excellent Ranjan. And right is male. Good answer. So this can be asked in your exam. Chalo. Now I have one more nice collection now. Now left and right. Okay. Now look at this left. Okay. Now this one. I'm going to explain the bone. You need to identify male or female. That's all. Just identify. Obturator foramina, we can see here round. Okay. Greater sciatic notch. Greater sciatic notch is deep and narrow. Deep है, narrow है. Obturator foramina oval है. Then, you know, so male or female. Acetabulum is large. Preauricular sulcus is absent. Preauricular sulcus is not there. Sacral part or sacral joint that extends up to 3 vertebra. So is it male or female? And it is heavy. Yes, guys, look at the sciatic notch. Sciatic notch is deep and narrow. Male or female? So this is classical male pelvic bone. So answer is male pelvic bone. Let's see, male. Mandible, yeah. So in practical class, I'm going to explain all the bones. I have 5 minutes for each bone. Okay, in practical classes. So now I have one more bone today. One more bone. Look at this. So this is basically sacrum. This sacrum, you can see here sacrum. there is curving forward in the lower part. It curves forwards. Okay. Look at the ala. So the ala, if you see here, it is 1:1:1. So simple way to identify, if forward curving is there in the lower half, then it is usually female. Again, it needs comparison. So the answer here is basically female. So again, other indexes are there, carpobasal index, and all. So that we are going to discuss in practicals. So time being, so this is sufficient. Female. That's great. Yes, Shubham Kumar, thank you all. We'll come up with some more important spotters and topics in tomorrow's class.